You have ongoing digestive issues and oftentimes find yourself asking the question, was it something I ate? Did something I ate cause these digestive issues, or is there something inherently wrong with my digestive tract? My name's Dr. Taranella, and in this video, we're going to break down all of the different causes for people asking this question. We're going to look at some acute and some chronic reasons why people ask this question and try to put it into categories so you can better understand where this is coming from. Again, my name's Dr. Taranella, and if you're new to this channel, I just want you to know that I make these videos to help you go beyond the basics of your health. Whether it's a confusing lab test, symptom, or diagnosis, I make these videos to help you get a better understanding of what's going on with your body and with your health. So if you like this kind of information on digestion, hormones, and overall optimization of your health, click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information contained in this video is for informational purposes only. It's not intended as treatment for any medical condition or a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deepen your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's check out this question. Was it something I ate? Was it something I ate? This is the first thing most people think of when they start to see digestive problems or start to have digestive problems. This makes sense because foods can and often do cause a lot of digestive issues. What we want to look at in this video is when it's important to look beyond the last 24 hours at your food intake for the culprit of your digestive symptoms or problems. We're going to break this down into two categories, acute and chronic. When I ask my patients how their digestion is, it's common for them to respond with, it depends on what I eat. Now, there's obvious cases of really poor food intake and therefore digestive problems from that. There's lots of foods that I can think of that will make most people really have a lot of digestive issues. However, some people are having these problems even when they're eating seemingly healthy foods. And so that's an obvious problem. So let's look at some of the common examples of digestive problems that occur from different foods. And I'll break those down into acute and chronic, meaning something that's more recent and something that's been going on for a long period of time. So first, let's look at acute. Of course, if something comes on really quickly and really acutely, you want to think about pathogenic things, foodborne pathogens, or some sort of infectious thing. When you consume contaminated food with viruses, bacteria, even parasites or other toxins, it can lead to a foodborne illness. Common examples can be things like salmonella, E. coli, norovirus, or even something known as Campylobacter. These types of pathogens cause a very acute, sharply demarcated gastrointestinal symptoms, which can be nausea and vomiting, diarrhea, abdominal pain, and cramping. And the symptoms come on really quickly. So it's very severe and quite obvious that you're going through something. There oftentimes can also be fevers and other more systemic generalized symptoms as well. Food poisoning is a similar kind of thing where, yeah, you did get dosed with a pathogen, but it's coming from their toxins. So bacterial toxins from something like Staphylococcus or specific types of bacillus bacteria can cause food poisoning. And this can cause similar types of problems as the actual pathogenic microbes, nausea, vomiting, diarrhea. It's usually going to be more short-lived though, because the actual microbes aren't living in your system that long. Food allergies can also cause an acute type of reaction. Certain individuals may have allergies to specific foods like peanuts, shellfish, eggs, or even milk. And so when they ingest those foods, they're going to have a very quick onset of an allergic reaction. Could be pretty mild symptoms like itching and hives, or very severe like an anaphylactic type of reaction like breathing problems and even going into anaphylactic shock. Usually accompanying those symptoms, depending on how bad they are, you'll have some digestive symptoms as well. They could be mild or moderate, gas, bloating, cramping, and even diarrhea. But it's going to come on fairly quickly from the time that you ate the food to the time the symptoms are there, less than 24 hours. And then the last one I wanted to talk about is sort of an unknown or a wishy-washy one, where there's some sort of foodborne pathogen or problem from something you ate very recently. This is where you go out to eat and you end up feeling not so good afterwards, digestively speaking, that is, and you may have diarrhea, severe bloating for the day. It doesn't cause fever or vomiting or really acute major problems, but it's enough to make you think something just didn't sit right and ask the question, was it something I ate? If this happens once per year, we would probably assume, yeah, it could have been the food. If it's happening once a month or once a quarter, then that kind of points more towards something going on with you. And that leads us more into the more chronic area. Let's look at some of the chronic causes of food-related digestive problems that leave people wondering, was it something I ate? So this scenario is the more common one when you're having symptoms ongoing for years or months that we would call chronic. They could be mild at first, but generally become more and more pronounced, more common, happening more often, where you find yourself wondering, did I eat something bad, or was it something I ate that's causing these current issues? There's actually a lot of reasons that leave people wondering what they ate or why they're having this problem. But let's look at the most common reasons that people have chronic issues related to what they're eating. So we've all probably heard of food sensitivities, but maybe don't know what the term actually means. So similar to a food allergy, food sensitivity is more of a delayed reaction. And those responses are actually going to be less severe. It also depend on how much of that food you consume. So you could have a little bit and not have a problem. When you consume larger amounts, you may be more susceptible to having some of these symptoms. That's common with like gluten sensitivities and dairy sensitivities. So again, sensitivity is more of a mild, delayed type of reaction as compared to an allergy, but they're both mediated by the immune system, where your immune system really doesn't like that, and it's causing a local effect as a result of consuming that product or food that then gives you the symptoms. Food intolerance, on the other hand, it has more to do with whether or not your body has the equipment, the enzymes to actually break down that food substance. For example, lactose intolerance means your body is lacking the ability to break down lactose. Lactose is a sugar found in dairy products and milk in particular, and lactase is the enzyme that allows us to break that down. So if you're lacking that enzyme, you basically end up with lactose intolerance. There are many other types of intolerances that people have as well, like gluten intolerance, disaccharide intolerances, and a lot of times the symptoms that occur from this can be indistinguishable from things like food sensitivities or other chronic digestive issues. Oftentimes when people have these problems with disaccharide deficiencies or enzyme deficiencies, they're going to have a lot of bloating, diarrhea, abdominal discomfort. And because the quantities are really going to matter in situations like this, they may be okay with small quantities, but larger quantities, they can't eat it. It becomes confusing. And so people often ask that question, was it something you ate? Another common problem that leads to chronic issues are things related to the microbiome. So you can have SIBO or small intestinal bacterial overgrowth, just an overall dysbiosis or imbalance in your microbiome, post-infectious IBS. So all these things are problems or issues within the microbiome itself. And when these are present, depending on how severe they are and the microbe present, certain foods will present as more of a trigger compared to others. They're going to create certain responses more so than others. And this one can be confusing as well because the symptoms can kind of come on gradually. So in the case of post-infectious IBS, you start off with, you have an acute foodborne pathogen that's introduced into your body. And over the course of a few weeks, it slowly gets a little bit better. And then, a month or so, all the symptoms come back and you think it can't be from that because that's long in the past, but the symptoms are coming on more and more and stays consistent with you. With this type of problem, it can be certain groupings of foods that the microbes prefer to feed off of, and that feeding on those particular foods creates fermentation, gas, and through that creates more bloating and other associated digestive issues like constipation or diarrhea. And so because it's groups of foods, you may only eat a small amount of gluten, but you had some other foods that are sort of categorically similar as far as the microbes concerned. And that causes those microbes to start to ferment that food and cause all your symptoms. So that one could be a little bit confusing as well. And it leaves people wondering, was it something I ate? So these more chronic issues can be confusing and challenging to track down and pinpoint, as there's multiple factors and sources for the triggers involved. A good first step, though, if you suspect some of this is going on or contributing to your symptoms, can be helpful to do like a food diary and note any symptoms that are occurring after certain foods. You might also want to do an elimination and challenge of specific foods, that are more likely to cause problems like gluten or dairy. You can do the whole AIP diet, and you can even do a FODMAP diet. Doing dietary experiments like this gives you clues as to where the problems problems actually coming from. Can be challenging, but you have to stay diligent with how you're tracking things and make sure you're 100% when you're following those diets and when you do the challenges. All right, how'd I do? Did that help you better understand? Was it something I ate? And how foods can sometimes be confusing in terms of whether or not they're triggering our digestive issues. Hopefully it answers some questions and doesn't leave you more confused. But if you do have questions about this, I know it's a big topic and can be confusing. So drop those questions in the comment section. Happy to answer your questions. We'll see you next time.